next guest hopes to inspire and educate you on alternative approaches when it comes to your health and wellness. This segment is sponsored by Healing Arts Centers. Dr. Tammy is back here to share more. Thanks for being here, Tammy. Great to see you.
Thanks, guys. Y'all are so fun. I love it.
Tell us about the work that you're doing at the Healing Arts Centers.
We do a lot of things, of course. Hormones are sort of the crux of everything that I do. And from an internal healing standpoint, when people are looking at joint injuries and things, and you just had the sports thing, I was like, that's so cool. There are a lot of sports figures like Tiger Woods that get regenerative injections. And, you know, anytime anybody gets injury, just chronic or acute, you know, I've had people that are kids that are actually going and being recruited, and then they'll get a sprained ankle or something.
Sure.
Well, that recovery time is critical, because now they're, you know, they have to get out of the game until they can get back in. So injuries, just anything from the inside out. I really like to address weight loss too, because if someone's heavy and they're putting the weight on their knees, and a surgery or steroids can actually break down the joint over time. And surgery is just, as you know, it's like downtime is massive with that, risk of infection, even risk of death. And so if you can do something like an injection, that's a game changer for people, especially elderly.
And we're talking about regenerative therapies today. What do we need to know about that?
So what happens is the body is trying to make a healing response. And when you have inflammation from an injury or somewhere else, we even do systemic like IV therapies. We have a couple of different routes that we can do that. We can take your own blood, we can spin that down and inject it, and we call that PRP, or PRF is the newer version of what we do. It's a little more complicated process. And then that has stem cells and healing factors. It brings in fibrin and platelets and all the messengers to heal that. I'm pointing to my knee a lot, but any joint can be affected.
Sure,
yeah. And then you can also do donor cells, and we call those umbilical allografts. That's a big word, I know. But it comes from healthy, ethically sourced moms and their cord bank stem cells that they basically put in.
Okay.
So those are a little pricier. If you can do your own, of course, that's, you know, a lot less. And when you're looking at the big scheme of having surgery or recurrent steroid injections and things, it's much less expensive to do that. But and the downtime, what's your life worth? And especially if you're not a candidate for surgery, people just kind of suck it up, and, you know, doctors tell them, well, there's nothing you can do. And, you know, we like to really do that from the inside out.
Sure. Another treatment, and let me make sure I'm saying this, hyperbaric oxygen therapy. Is that right?
You lit up.
What do we need to know about that? You seem very excited about this one.
Well, at sea level, you diffuse oxygen at a certain capacity into your cells for healing. And once you go below sea level, most people know hyperbaric oxygen chambers, like when you get the bins, like for divers, because it's pushing the pressure of nitrogen bubbles out if you come up too fast. So when we can push the oxygen into the cells, the healing properties happen so much faster in the body. And so whether you have an injection or not, it will maximize your own body's stem cells that come from your bone marrow up to 800%. I cannot begin to tell you what I've seen. It's approved for wound care, so ulcers and things that people get, because those capillaries are so sparse to the surface of the skin. So if you can push that oxygen in, and this is fascinating, combination between stem cells and hyperbaric is lizards, when they lose their tails, they get pulled off by a little kid or something, they regrow their tails.
Yeah, they regenerate, sure.
By their ability to increase their stem cells from their own bone marrow to that area, and then the oxygen, they can maximize their oxygen through hemoglobin and things like that. So people always ask me, am I going to grow a tail?
Right, yeah.
No, you're not. But you can absolutely regenerate tendons, ligaments, bone, whatever is having a problem in that area.
Sure.
Really good for acute injuries. And it really works well for chronic too.
Sure. Dr. Tammy, if our viewers right now want to reach out to you, they've got more questions, or maybe they want to consider some of these alternative approaches to medicine, how do they do that?
Just come visit us at thehealingartcenters.com and just have a little consult, and we'll sit down and we'll talk about where you're having your pain and what your options are. A lot of people don't know we also do red light therapy, and we have a shockwave machine, which is absolutely amazing, which breaks down scar tissue. So we do it all together. Very integrative medicine, as well as regenerative medicine.
Dr. Tammy, thank you so much for joining us, filling us in on these alternative approaches. We appreciate it. Stay with us. We got more Good Day NWA after a short break.